Hey guys, this is Dr.B, and this video is the first of many in my Ace the PLAB series. Today we're going to learn about ethics, and whether you're new to this topic or not, we're going to make sure that we add some clarity to your concepts so that you can score highly on the PLAB. As always, all the information I give you guys is up to date and can be verified through the NHS website. Feel free to check out the video description below for timestamps on everything I cover in this video. And without further ado, let's begin. There's a protocol of reporting to tackle this situation. Let's try to apply this in a scenario where you suspect your fellow doctor is under the influence of alcohol because he smells of it. Talk to him or her first before informing the senior as per protocol. In the event that he refuses to accept or change his ways, you are forced to report him to his superiors. In times where another person's health or safety is at risk, you're allowed to breach confidentiality. Let's say your patient discusses the possibility of harming his neighbor because he makes a lot of noise at night. Having this information, you are obligated to inform both the subject of the situation as well as the police. Now, when I say subject and police, I actually mean subject and police, not either one of them. Because having the knowledge of a possible threat without informing the subject as well puts the subject's life at risk. Let's say patient has a disease and he doesn't want his primary medical physician or spouse to know. The rule of thumb is to first identify if the disease is transmissible or it isn't. Transmissible diseases include pneumonia, TB, meningitis, etc. Bloodborne disease such as viral hepatitis, HIV, or other STDs. We don't report such diseases because standard blood drawing techniques don't change irrespective if a patient has a bloodborne disease or not. The exception applies to healthcare workers such as doctors, physicians, or nurses, since their blood puts the patient health at risk during needle prick procedures or during surgeries. I must add that although sexually transmitted diseases don't have to be reported to other health professionals, they indeed need to be reported to the patient's spouse or partner, since they risk his or her health. If the patient doesn't agree to inform the partner himself, it becomes a doctor's obligation to do so. In cases such as losing patients' files or making the mistake of divulging information to unauthorized people, you must report the confidentiality breach to the information governance lead, who will then attempt to secure the breach. The legal age for seeking consent is 16 years old. However, consent may be obtained between the ages of 13 to 16 if the person demonstrates the ability to understand his or her choices. Exceptions to the rules of consent includes those who lack mental capacity, which we'll discuss in just a second, as well as seeking legal advice, using the law to help out in gaining consent with people who would have made a wrong decision. This applies to a certain set of situations, such as a young person who is mentally competent and who refuses treatment that's in their better interest. So we would seek legal advice in their case. Now, coming back to mental capacity, this will require a doctor, not specifically a psychiatrist, for example. Any doctor can do this. The doctor will have to assess the mental capacity before deciding a person fit to consent. You must also keep in mind that dementia with age, such as forgetfulness, impaired reasoning, or personality changes, may be a normal consequence of aging, so they don't really indicate mental impairment. Unless the question stem hints you to a person's mental impairment, you don't need to mentally assess the choices of every single individual. Consent in an unconscious individual is not required if it's in their better interest. Now, when I say their better interest, I mean the patient's better interest. For example, if a blood test is required in an unconscious patient, as long as it's in their best interest, it's okay. Now let's twist the scenario and say that a patient requires blood to be drawn for a specific set of tests. Let's say a nurse pricks herself during this blood draw. Now the nurse is afraid of contracting a blood-borne disease from the patient. So she wants to get a screen of the patient's blood. Now this wouldn't be allowed. Well, why is that? Because remember, consent is not required if testing is in the patient's best interest. In this scenario, it's in the best interest of the nurse and not the patient. So the patient would have to return to consciousness in order to consent to the screen. Jehovah's Witnesses are a Christian denomination that believe it's against the will of God to receive blood or any blood product. This applies to transfusions, be it their own blood included. Jehovah's Witnesses usually carry a blood refusal card, which legally prevents medical professionals from administering blood or blood-related products to them. In the event that a Jehovah's Witness is unconscious and no card can be reproduced, or there isn't any advance health directive or power of attorney present, the patient can be transfused. Otherwise, they have to be given IV fluids to augment their circulating blood volume. In cases of possible crime, it's your duty, being a healthcare professional, to treat the patient irrespective of the nature of their injury. However, police must be alerted in suspected homicidal cases. This means you can start a patient's treatment and call the police to inform them of the nature of the person's injuries without disclosing their personal details. Let's say that, for example, you have a middle-aged white man with 3 gunshot wounds to his abdomen. You can give the police this information without giving them his personal details. When police does arrive at the hospital, you may then divulge the patient details or allow the police to meet the patient only if the patient consents to this. A coroner's job is to perform an autopsy to identify the cause of death in certain situations as specified. This will stand in a court of law for which the coroner is summoned to testify. In cases where the patient doesn't speak English, a hospital language line is available 24/7 for translation purposes. In the event of an emergency, the line may be tried. However, if no response is obtained or if it's taking too long to get translation when someone's health is on the line, the rule of thumb is to proceed with the treatment in the patient's best interest unless the patient implicitly denies it. An example could include the emergency C-section for a pregnant lady demonstrating fetal deceleration on the CTG. In this scenario, unless the mother had implicitly denied the doctor from going ahead with the C-section, any ambiguity, be it even in language, will allow the doctor to proceed with the decision that's in the best interest of the patient. UK law mandates that an unborn child has no rights, and the priority is given to mother over child when it regards life or death situations. You may abort a child legally before 24 weeks. However, after this time period, unless the mother's health is in danger, abortions aren't allowed. Legal age for engaging in sexual intercourse is 16. Before the age of 13, it is completely illegal, and between the ages of 13 to 16, it is relatively illegal. When I say relatively illegal, it means that although it's not allowed in the law before the age of 16, it is, however, permissible if both participants are minors. Now, a gray area exists in the law where the rules of consent overlap with this. Minors between the ages of 13 to 16 are able to give consent by the law if they are demonstrated to be mentally competent to understand their actions. In this case, they could technically be having adult intercourse since they can give consent, despite being illegal to engage in such an explicit relationship. So, unless the mentally competent minor openly discloses the age of their much older partner, they can avoid further questioning from medical personnel. Suspect abuse in patients who have had abnormal bruising on their limbs and they avoid maintaining eye contact. Always follow protocol in such patients. As doctors, we often receive gifts from our patients, sometimes as a thank you for our services and other times as an incentive for superior treatment protocol over other patients. Since we believe in equality amongst humans, we are obligated to provide the same treatment protocols towards every single patient. We thus refuse gifts that are considered expensive, being a value of greater than £100, and we are allowed to accept cheap gifts in order not to harm the good relationship between the doctor and the patient. So guys, this concludes this topic. Hopefully you all learned something here today and you're ready to knock out some questions and practice safely. I started this series as a free resource for everyone to use, as I remember being at your stage not too long ago without anyone there to help me. So if you think you learned something here today, smash that like button and consider subscribing if you enjoy my content. Stay safe everybody. I'll see you all in the next video. My name's Dr. B. Later.
Yeah.